Good morning, everybody. I think we're going to go ahead and get started. I know there's still some folks coming into the room, but I want to respect everybody's time. Good morning. My name is Michael Valaire. I am the CEO of the Institute for Healthcare Advancement. Our team and I are the ones bringing you this conference. So first of all, thank you for being here. We really appreciate it. I just wanted to make a couple of comments this morning and address the fact that we have had some technological challenges during this week. And first of all, apologize for those. The team on the platform behind the scene has been working, I can attest, into the night to make sure that the site is as trouble-free as possible. But of course, as you know, in our new reality, this is our first time presenting this conference on a digital platform, on a virtual platform. Our team is all working virtually, so we don't have a chance to quite huddle up as we normally would. So a lot of new things for us and for you as well. We certainly realize everybody's realities are just a little bit different right now. So number one, I just want to acknowledge that the team is aware of the technological issues. You should have all received an email in your inbox this morning with a link in the event that anything bad happens today, and I'm knocking on wood. Hoping that we go smoothly. If we do have any issues with the site, you should be able to follow the instructions in that email and get a direct Zoom link that should take you right directly into the session. So hopefully any disruption that may happen will be as minimal as possible. Second of all, I just want to acknowledge something. We realize, I especially realize that taking time out from your schedule to attend a conference is something that we understand and we certainly respect. I know a lot of you are working from home. Your duties now include not only professional duties, but personal, perhaps caregiver duties, and you're scheduling the time for these sessions, and when these sessions are not available, having to reschedule time to see those presents a challenge for you. So I just want to say I recognize that, I appreciate that, I respect that, and I'm very sorry if, to whatever extent these disruptions have caused you any difficulties. That being said, I have to say the sessions and the speakers and the content this week have been absolutely stellar. All the sessions are being recorded and will be available later. Monday's session is available now on the site, and yesterday's session with Cynthia Bauer. So I'm going to just wrap up and turn it over to the panel, but I just want to say again, our apologies for the technical difficulties. Thank you for being here. We really appreciate it. We appreciate you. And I'm going to turn this over now to Casey Mank from the Center for Plain Language, and she will get you started, and I will say thank you, everybody, and bye for now.
Okay, thank you, Michael. Hello, everyone, and welcome to this session of the IHA's 19th Annual Health Literacy Conference. My name is Casey Mank, and I'm a newly elected board member at the Center for Plain Language, and we want to thank you for making time to join us today for this talk between our board chair, Barbara Kingsley, and health literacy expert, Rima Rudd. So I'm just going to go over a couple of housekeeping items before we get started to make sure that everything runs smoothly today. First of all, this plenary and all of the breakout sessions will be recorded. The video recordings will be available for you before August 3rd, and you can find today's presentation slides on the session page under the tab labeled Handouts. All attendees will be muted during the presentation, so you'll be muted, but you can engage with us in the Q&A box. So if you want to take a moment and go look where that is right now and find it in your Zoom screen. The Q&A feature will be enabled, and if you have questions for the speakers, you can use that Q&A box. We'll be holding all questions till the end when I will read through them, and we'll try to get Rima and Barbara to answer as many as we have time for. If you have any tech issues or IT-related questions, you can email support@limitlessasr.org. And for other conference-related questions, conference@aha4health.org. You have the emails here, and the emails are both also on the conference homepage for you if you have any issues today at all. So if you are interested in CEU's continuing education credit, there are 2 surveys, a session evaluation and an overall conference evaluation for you to fill out. So this is just a friendly reminder that in order to request those CEUs, you'll need to complete the evaluation survey, which will be available and it'll be emailed to you tomorrow, Friday, July 24th. You need to submit both the evaluation and a CEU request form in order to receive your CEUs. Another reminder is that we have poster presentations available under the posters tab on the conference homepage. There was a poster competition, so you can read more about the award recipients on the award recipients tab on the conference homepage. And now I'll tell you a little bit about today's plenary talk. Today we'll be discussing how plain language is imperative to helping people find, understand, and use information which allows them to navigate complex topics to make decisions that affect their lives. Our work is based on equity and social justice to remove unnecessary barriers to information, services, and care. In just a moment, you will hear how using plain language can lead to socially just outcomes and the responsibility that government agencies have to use these plain language principles. If during this session you have a thought or an idea that warrants a deeper discussion, please use the Plenary Sessions Workgroup Survey in the Engagement Center tab on the conference homepage. Throughout the week, we'll be collecting your ideas to present overall findings on Friday, so tomorrow, and to continue collaborating after the conference. So again, that's the Engagement Center tab on the conference homepage. If you have any thoughts from today's talk that you want us to know about, please use that tab. So it's my pleasure to introduce our 2 speakers for today. Our first speaker today is Rima Rudd. For over 30 years now, Rima has been a member of the faculty at the Harvard Chan School of Public Health. Her teaching, research, and policy work focuses on social justice and equity through community engagement and health literacy. Our second speaker today is Barbara Kingsley. Barbara is an award-winning information design and plain language expert whose work focuses on how individuals, particularly vulnerable populations, use print and online information. She's chair at the Center for Plain Language, an organization that champions clear communication so people and organizations can thrive. And just a reminder, please submit any questions you have in the Q&A tab. Rima, if you want to turn on your camera and mic, I will now turn it over to our first speaker, Rima Rudd.
Great. Can you see me?
Yes, Rima, we can.
Good. Okay. I just want to say a very warm hello to everyone from the very warm area just outside of Boston. I'm really delighted to be with you here today. Yesterday's very powerful opening panel offered clear explanations of literacy issues. That was Teresa's presentation, and very wonderful examples by Janet of how we can put health literacy to action in service of our democracy. This session is really, in a sense, a continuation of that, because we want to illustrate how our health literacy lens and our skills can help us identify those important factors that support or inhibit access to information related to a wide variety of activities. First, though, we have to expand our understanding of health literacy and pay attention to a variety of key factors, not just the skills of individuals. And in sharing some slides here, I'd like you to see that health literacy is really at the center of some very important interacting components. Next slide. One, of course, is the skills of individuals. But when we think about skills, we also have to think about our skills. Next slide. The skills of health professionals, very, very important here, because we can make an important activity, we can make an important contribution, and we have to hone our communication skills. The other important component that we have to attend to are the texts that we offer people. Text can be talk, next slide. It can be writing online, it can be presentations, it can be pamphlets and booklets. We health professionals construct those texts, and we are responsible for improving them. By improving them, we increase health literacy. We also, next slide, have to pay attention to the tasks and activities that we expect people to undertake. And it's our responsibility as professionals to make those tasks and activities as simple as possible, as easy as possible and to remove any barriers of complexity or confusion that might exist. And next slide, both, and the next one as well. We have to pay attention to the context, to the environments within which people are taking action, whether it be a health center, a hospital, a courtroom. There are structural, health-related, literacy-related, numeracy-related barriers that we as professionals can identify and eliminate. Thank you. We can end the slides now. So in order to expand our understanding of health literacy and pay attention to these important factors, we are applying skills and insights that we have learned from health literacy studies, from health literacy actions on the ground, and we can reapply those same skills to help reduce disparities, support equity, help us engage in respectful dialogue with people. Our health literacy insights and skills can support social justice through partnerships. And I want to note here a brief experience that, not directly related to health, speaks to our shared social goals. Last year, I was contacted by the Southern Poverty Law Center, asking if I were interested in filing an amicus brief in support of an appeal that was taken up by the ACLU. This appeal was related to a traffic violation, clearly not health. But sadly, we all know some of the awful stories related to driving while a minority in this country. What happens after someone is stopped and ticketed? In most states, a letter is sent out issuing a fine, noting the consequences of not paying on time. Often those consequences can be dire, with costs rising daily, the loss of a license in the wings, and a possible jail sentence for perhaps driving to work without a license. But let's put those issues aside for a moment and focus on the letter, which is exactly what I was asked to do. The letter was barely comprehensible. It was filled with uncommon words, legal jargon, and only indirectly indicating what the individual who received that letter needed to do. It alluded to, but did not directly state available options, such as requesting an extension or asking for financial aid. I examined the letter as asked, and I used first the SMOG for a reading grade level. As we all know, a reading grade level is the most superficial analysis that we can do, but it's the start of a real analysis. After I did that, I considered the next assessment stage. Should I use the SAM developed by Doak and Root? Should I use the CDC Health Literacy Index or the AHIQ PMAT? I'm assuming that you're all familiar with these tools that are available to us. And if not, I would really urge you to become an expert in applying these assessment tools. I realized, however, as I was thinking about which tool to use next, that in a court setting with a focus on a traffic issue, an assessment that is labeled a health literacy tool would not be the way to go. The score could be ignored because, after all, this was not a health text. And then I recalled the report card that I have read over the years, issued by the Center for Plain Language, and thought, their assessment approach might be better understood by the courts. This report card, as you will learn, assesses communication from a variety of US government agencies. I then reached out to and partnered with our next speaker to serve an important non-health related cause, but one that similarly pursues our goals related to equity and justice. Our purpose for this session is to help you keep in mind that the research findings, the lessons learned from practice, the insights gained over the years from health literacy efforts can illustrate how we can partner with so many others working for social justice. We can apply those skills, helping other agencies, helping other groups, helping other causes. There's important work to be done. We can take action by partnering with, training, teaching, sharing with others who may not be working directly in the health field, but who share our goals and who strive for social justice. We have skills. We have insights to share. We have tools to make efficacious change, to promote dignified dialogue, to make information accessible. We can be among the first responders in times of dire need, in these times, in these fraught times. So I meant my words, my very brief talk, by way of introduction to our next speaker and to a skill set that we really need to think about and focus on and share with others. Thank you.
Thank you.
I'm finished.
Thank you so much, Rima. I appreciate the introduction. And I want to echo what Rima has talked about, the importance of clear communication and how we can use that to emphasize people's rights. And we can use plain language to help us provide social justice in a range of situations. So anything from a DMV notice, which we worked on together, to medical communication, to health rights documents, all kinds of communication can benefit from the use of plain language. So in this presentation, I'm going to focus on first defining what we mean by plain language, and then showing how the Center for Plain Language has developed some ways of helping ensure that government agencies use plain language in their communication. And then we're going to go through an example of how we can work with users, work with experts, and create a plain language document. So let's go on to the next slide. So first of all, we want to start with a definition of plain language, because one thing I've realized after talking to many groups is that we don't always share the same definition of what plain language is. So first of all, at a surface level, I think we all recognize what plain language is. Next. So let's start with just a silly example. Go ahead and let's build this slide. Somehow, next, if we can move on, Mario, to the next, yes. So somehow a feline with a stringed musical instrument and a hurtling bovine is not quite as plain as a cat and a fiddle and a cow jumping over the moon. Next. Next. And we have signs like this that we encounter. So this is actually just a few sentences, should be quite easy to understand, but it's really difficult to follow since it's nearly impossible to understand what this sign is telling us. Next. Next. Sometimes we have infographics like this. This is on the topic of property seizure. And I truly applaud this government agency's desire to make this complex topic more clear by using design. But I'm not sure they quite succeeded, since it's almost impossible, again, to follow what this design is telling us. And again, this is about property seizure. So it's an important piece of content that you want your users to understand and be able to follow so that they can exercise their rights. Next. However, things can get complicated in all kinds of documents. This is a sentence from a healthcare privacy practice document, and we're going to talk more about that at the end of this session. There are important requirements and patient rights in this one sentence that we have here. But the meaning is obscured by difficult words, and it has an almost impenetrable sentence structure. So again, the rights are not being clearly communicated. Now we have an issue of access, because one cannot understand and be able to exercise a right if they can't understand what it means. Next. So what does plain language really mean? So I find that people tend to want to confine plain language to the realm of words and even sentences. However, easy sentences are not useful when they come in an overwhelming and difficult design. And words and sentences and even design come together to create meaning, which must be viewed in the context of a person's life experience. So, for example, when one is faced with a catastrophic situation or they are operating in a situation of an emergency, that's a different situation requiring a different type of design, a different set of words than if they had a 5, 10, 20, 30 minutes to sit down and read a document at their leisure. So we have to view things within the entire context. A simple document where words, sentences, and design work also has to be meaningful to that audience and lead to the correct outcomes within that context. So we have to think about the document in terms of the outcomes that we're trying to achieve. What do we want them to do with this? What are the next steps they need to take? What's going to be success when they use this document? Next. So there are 3 international organizations that focus on plain language: Clarity International, Plain International, and the Center for Plain Language. These organizations advocate for plain language really in all documents, in all contexts. And right now, these 3 international organizations have agreed to one definition of plain language, and you can see it right here on your screen. I want you to notice a few elements of this definition. First of all, it goes beyond words. It focuses on wording, structure, and design. And it also focuses on a set of outcomes. And those outcomes are that an audience can find the information, understand the information that they find, and use that information for a desired end. So all of these organizations are working together right now to embed this definition into an ISO standard. So that's an exciting next step for our profession, that we find an international standard that we all agree on that can be used in all documents. The Center for Plain Language, which I chair, is a North American advocacy organization. And when this organization started, it was truly a labor of love of some individuals who had come out of primarily government, and they wanted to work to advocate for clear language in all documents. But they were specifically concerned about government documents, many of them having come out of the government, as I mentioned. And they wanted to ensure that the government created truly citizen-centric documents that people could use and understand. And they were advocating for these types of documents. However, our founders, primarily Annetta Cheek, who some of you may have heard of, knew that unless the government was required to use plain language, it might not use it, might just ignore the concept of plain language altogether. Next. So the center began the arduous process of creating a law and passing a law. So this took a long time, as you can imagine, finding people within legislature to advocate for this and to get this law passed, but we got it passed. That was in 2010. This is the Plain Writing Act. As you can see, it is not written in plain language, which is unfortunate, but it does essentially require that the government write in plain language. So this was a big win for the center and really for plain language activists everywhere, that there was now something in writing that shows that government needs to write in plain language, meet the needs of citizens. Next. Here's what the law says. It requires that writing be clear, concise, well organized, and follow other best practices. And it also requires agencies to staff positions in plain language, to train employees in plain language standards, and to report on progress on an annual basis. So it requires quite a bit of government agencies. Next. Unfortunately, the law really has no teeth because there isn't a plain language police force to go out and enforce the law. And there really is no way to enforce that government agencies do this. So it was definitely a victory for plain language advocates, but somewhat of a hollow victory because we still had to figure out how to ensure that agencies take action and comply with the law. Next. So we attempted to give this law teeth through a federal report card. So the Center for Plain Language each year publishes a report card. We do this every October or November. And every year since 2012, we've graded major agencies on two elements. First, compliance. Just simply how well do they comply with the law in terms of staffing, training, and reporting. However, we go beyond that and we also give them a grade on the quality of their writing. So compliance is relatively easy to measure. You can find the staff members listed on the website. Most agencies have a web page that reports their progress. And for writing, we choose each year to poll samples, usually a certain type of sample. Last year, it was web pages that dealt with urgent information. So something urgent that that agency has to get out to its public. And then we use multiple judges to evaluate how well these documents or information from a website or online source meet the principles of plain language. And those principles are understanding of audience needs, style and voice, structure and content, information design and navigation, and use of pictures, graphics, and charts. So we bring our judges together who have been normed, and each one of these principles has sub-principles that support it. And they take a look at the document, give it a grade, and they come together and ensure that they're seeing the same things in the document, and then these are the grades that they get. So you can see we have everything from an A+ at the Department of State in compliance, down to a C+ at Homeland Security for quality of writing, or HUD gets a D on their writing quality. And this is really a way of keeping these organizations accountable to this law. Next. Here's a good example of an effective piece of writing. So again, this is from an urgent help page. And you can read some of the judges' comments here. How well this follows plain language principles, sections are organized, it was tested with users, and it has a conversational style. It uses I and you. And so these are things that we know help users be able to find, understand, and use the information for its intended purpose. So as you can imagine, agencies really like getting good grades. This is exciting for them. They can publicize this. They got an A+ from the Center for Plain Language. On the flip side, they really do not like getting poor grades. And so that is something that is a bit of a public commentary on how well they are meeting the needs of users in terms of how well they're complying with this law. This process, we find, provides some level of meaning for the Plain Writing Act. It provides a method by which we, as the center, can continue to advocate for plain language, and even more importantly, get good information to citizens, because that's what this is really all about. It's not about grading. It's not about putting anybody, hanging anybody out to dry. What we're really trying to do is get good information to citizens to help them understand the things that they're required to do that are sometimes quite difficult, like filing for taxes, and helping them get things that they have a right to have, like assistance. So we find that this type of report card is a way of, again, giving that law some teeth. Next. And this brings us back to the concept of social justice, which is where we started. Plain language isn't just a fun idea, although you can find fun examples of plain language, as I showed at the beginning. It's really a necessary action. Rights are meaningless if there is not access to those rights. And access cannot happen without understanding. So we have to break down these barriers in terms of complex concepts, complex information, for vulnerable people. And as Rima mentioned, when we looked at the DMV document, a lot of times people want to say something like, oh, well, it's just a DMV letter. However, people's inability to understand that DMV letter means they don't know how to pay their fine. Next up, they get their license revoked. Next, they don't understand how to get their license out of revocation. Next, they're now driving without a license because they have to go about their daily lives. And they are now caught in a spiral of more and more and more costs. So we find that just one piece of information that's unclear can lead to many negative consequences for individuals. And unfortunately, the most impacted are those who have the least ability to understand. So we need to think about the level of understanding that we are providing to individuals to help them have access to their rights. Also help them understand their responsibilities under the law. So there are two things that we're helping with here, rights and responsibilities. Next. So how do we get there? Because I've told you a lot about how we measure plain language, how we look at federal documents, but in the end, I want you to be able to walk away from this presentation feeling that you have a sense of what it takes to create a true plain language document. So we start by really trying to get into the minds of our users. So we want to identify our audience, but audience is a very big term, and it's somewhat of an amorphous term. I like to help people think about individual users. Who's the person that's going to be using this? Can you imagine that person? What situation are they in the moment that they're using the information that we're creating? Are they in a doctor's office? Are they in the middle of an emergency? Are they sitting on their couch? All of those contextual pieces of information are important in terms of what we create. Next, we want to structure the content to guide the reader through it. Again, we want to do the work so the user or the reader doesn't have to. If we create a clearly structured and organized document, it makes it incredibly easy for someone to be able to read it and use it. Next, we want to write that content in plain language. So we've thought about the user, we're structuring the content, but we want to make sure that those sentences are clear, concise, active voice, don't use bureaucratic language. Then in step 4, we want to use information design principles to help readers see and understand what's happening in the document. We know we have so much research about things like using headings, using advanced organizers, using clear graphics, how to create infographics. So we want to use all of the tools in our arsenal to help our intended audience find, understand, and use the information. Next, we want to work with our user groups and we want to test the design and the content. So no matter what we believe works, and we may hypothesize that we have the best document in the world, it really doesn't matter until we test that with our users, because really they are the ultimate test of whether the document works or not. Many times I have tested and I have been surprised and humbled at what I have learned from my users in that testing situation. They will notice things that I can't notice, and that's important for me as a designer. Next. So I'm going to take you through a project that we worked on, and this was on the HIPAA Notice of Privacy Practices, which I will refer to at some points as the NPP, just because it's less of a mouthful. So we've all gotten these. We get them all the time. Sometimes we get them every time we go to the doctor, and they explain our privacy rights and the responsibilities of the organization to us to protect our privacy. So a few questions about the NPP just for you to think about in your own mind. You get these. Do you read them? So think about that. Do you read them? Have you ever read one? Do you think that they matter? So that's a good question, because I often find that people say, I do think this matters, but I don't read it. So really, we don't usually understand the privacy practices of the organizations that we engage with for our healthcare. So just a quick question, if information matters, but it isn't ever read, did it ever really exist? So we want the information we create to matter. It needs to matter. If we're creating it, if we're giving it, we want it to be read. We want it to be used. We want it to be understood. Next. So when we developed these new notice of privacy practices, this was around 2016 to 2017, so a few years back, new regulations were passed. And just to give you a little bit of sense of the context, when I walked into the first meeting with the lawyers from Health and Human Services, their legal compliance and Office of Civil Rights, the regulation was about this big. It was in binders. So this was how much we were dealing with from a legal perspective. But we now have to communicate that to regular people like you and me, who are going to go to the doctor, and we want to understand our rights and understand what that organization is going to do with our information. So we started by talking with some user groups. We talked with 3 different user groups. We talked with practitioners, and by practitioners, I mean legal compliance officers in organizations like hospitals. We talked to privacy experts. But most importantly, we talked to average consumers, people out there who go to the doctor. So that's just about everybody. And here are some of the things that they had to say. Mario, if you could go ahead and build this slide. So some of the comments we got, I don't want my information everywhere. I want it to stay in that building. It's private. Well, unfortunately, that is not the case with your information. It goes a lot of places. The more people know, they're more scared. You read these and you think, oh my God, what are they doing with my information? Some people said, hey, look, they just give me a stack of paper. I just sign whatever they tell me to sign. Some people really started talking about their rights. I want to know what I have a right to do with my information. It doesn't matter if I exercise that right or not, just to know you can if you need to. People were very concerned about their rights in terms of privacy. So we took the information we learned from practitioners, from privacy experts, and from users, and we started to think about what that means in terms of the user process. And it was very interesting because we had users who were very concerned about their rights. What are my rights? How can I exercise them? And we had privacy experts that were also concerned about rights. They were concerned about really the law. What are we giving to users about this very complex piece of information? And our practitioners, our legal compliance officers, they were most concerned about telling people what they share and don't share, because they want to protect themselves legally. They want people to know, hey, here's what we give out, here's what we don't. Next. So we took all that back and we kind of started from the beginning. Okay, who is our audience? We have this very enormous audience, and it goes from people who have high understanding to very low understanding, high literacy to low literacy. And we started to think about the user process. So just some key elements of the user process. First is exposure. So really, how do you get exposed to the piece of information? And what's the context of that? For many of us, this is when we're sitting in our doctor's office and we're getting ready to go in and see our physician. Consumers pay attention to what's relevant. So if it's relevant to them and they think, hey, this has to do with me, they tend to pay attention to it. They understand and assign meaning to the things that they believe are important, okay? So all of this is really connecting into the user's mind. It's all about what they think is important, what they feel is useful to them. You have to draw their attention. You have to bring them into the process. They make decisions and action based on the information that they have, and then they take what they believe is relevant and they save it. They retrieve it, they retain it, and they use it in the future. Okay. Next slide. So in terms of writing for our users and thinking about these stages in the consumer attention and use and retrieval process, we had to think about some key questions. So how do we explain privacy? Since people believe that privacy means you won't share my information, and we know that's not true, how do we explain it in this way? Should the NPP emphasize rights that people have, which the consumers wanted, or sharing, which is what the practitioners wanted? And it has to do both, obviously, but what do we emphasize? How do we make consumers notice the document? Since we know they need to have attention drawn first, they need to attend to it. How do we do that? What will compel consumers to read this document? And what action do we want consumers to take? So let's move to the next slide. So then we begin the process of structuring our content, and you can go ahead and build this slide, Mario. This is from our actual meeting, and you can just ignore that really bad writing, that's mine. But this was where we worked through the content on whiteboards. What are we giving users? What is this going to look like? We considered a layered notice because we knew people wouldn't read everything. We considered listing the rights first before the disclosures because that's what users were most interested in. They were most interested in their own rights, what they could do. And we were trying to go from what people can control to what they can't control. You can control your exercising of your rights. You can't control what the organization is sharing or not sharing. But most of all, we were trying to let go of the legal words and to find new ways to talk about this in ways that the user could understand. So let's take a look at the next slide. Here is some of the content. Go ahead and build this slide. Here's some of the content in plain language. So your rights, we used you and we, active voice. Here are things you can do. We used words to explain what access means. In the past, it would say you can access your records. Well, what does that really mean? That's a very generic and ambiguous word. So you can ask them to correct your record. You can request confidential communication. We made it action-oriented and tried to keep the tone as consumer-oriented and friendly as possible. So you can see that this looks different than a lot of the NPPs that we see every day when we interact with our healthcare organizations. Let's go to the next page. Go ahead and build this slide. We use the information design to help people see and understand the information. So you can see your information, your rights, our responsibilities, and it moves from the concept of your rights into your choices. Again, these are things that individuals can control, to our uses and disclosures, and then our responsibilities. So in a way, we really flipped this document from what it was originally. So it started originally with our responsibilities, our uses and disclosures, and then moved into rights. But we knew that consumers wanted rights up front. And again, this is all about giving people access to their rights, helping them understand what they can do in a complex situation. So flipping that around and putting those rights up front is better meeting user needs, and it's more likely to draw their attention because they're seeing what they can do. So you look at these pages and you think, well, that's very nice. That probably took a few days to develop. In fact, it took many, many months. And the reason why is because we did 5 rounds of iterative testing. We started with 7 different designs. And in the end, we had 2 that worked. This is one, I'll show you the other in a moment. But we were looking at many consumers from a range of ages, education levels, and socioeconomic statuses. We were in different geographic areas of the United States, and we made changes in between each round and narrowed those designs down to the ones that really worked the best. And again, when we're talking to consumers, we are always surprised at what we find. They will notice things that make you as a designer, as a developer, think differently about your content. So we always advocate testing because it provides a new way to look at the information. I often find that as designers and as subject matter experts, we suffer from what Steven Pinker calls the curse of knowledge. We know things, and we know those things so well that we forget what it's like to not know them. So we write from ourselves and we write what we know, and we forget that there's someone out there that doesn't share our knowledge. So we have to get very basic for them so that they can understand at their level what we understand so well. So let's take a look at the next slide. This was a layered version. This was the other version that worked quite well. Normally, we would only come up with one design out of this process, but both of these designs worked incredibly well. HHS decided to keep both of them as something that organizations could use. So this layered notice chunks the information and puts a summary up front and then sends people to more information behind it. So this is really a summary of your rights, your choices, our uses and disclosures, and then sends them somewhere else a little bit further into the document where they can get more information about that. Let's go to the next slide. So in terms of this document, what we were doing was testing this, as I said, with target users. It was first assessed and developed using the center principles. Then we went through 5 rounds, as I said, of iterative testing, 27 consumers total, range of demographics. And in that testing, we use one-on-one think aloud protocols. So in this testing, as you can see, we're not testing huge numbers of people, and you really don't need to when you're in a developmental phase of creating a document. Really, what we find is that as you're developing, you want to go deeper with fewer participants who will give you a lot of information. When we sit down to test someone, we first start by just asking them to think aloud as they use the document or read through the document. We usually give them a task or scenario, and we don't ask any questions. We just listen to them talk. We find that this gets a lot of information about how they first see and feel about the document and how well they understand it before we begin to bias them with our questions. Because once you start asking them questions, they now know what you're looking for. And they want to try to give you the information that you're looking for. So we spend a lot of time with the think aloud, and then we move into structured questions about things that we are particularly interested in. So this is a very useful technique as you're developing information. And again, we narrowed the designs down. Excuse me, I said 7. There were 5 initially. We narrowed that from 5 to 2. This is a process that you can use in any document that you are developing. So HHS, when they developed these new notice of privacy practices, these were not required. They did not require organizations to use these templates, but the templates were available, and they've been downloaded hundreds of thousands of times. So there are healthcare organizations out there using these now. And this is a really excellent example of how you can partner with a government agency, help them create information that real people can find, pay attention to, understand, and use, and be able to know that you're helping those citizens have better access to their rights. And again, one of the most important parts about this, or one of the most interesting parts for me, was how much people wanted to know those rights. They really wanted to know, hey, if I have a question about how my information is shared, what do I do? Can I ask them to restrict this? So again, we're talking about these fundamental rights that we all have as citizens and trying to help people get access to those rights by enhancing understanding. And this is something I challenge you with all of your documents that you work with, thinking about, what am I trying to communicate? What are the rights that this individual has? What are the responsibilities that they have? Or what do I want them to take away that's going to enhance their health or protect them? And as Rima said, we are living in fraught times. If there was ever a time that we should be focusing on, how do we get the clearest, plainest, most actionable information into people's hands, it's right this moment. So that's my challenge to you, to think about all your information through that lens, and become plain language advocates yourself. We invite all of you to advocate for plain language with all of your clients, with all of your partners, and that we make this really an environment of advocacy of plain language. So that is it for my part of the presentation. Casey, I'm going to turn it back to you now.
Fantastic. Oh, and we have Rima here as well. Okay, I'm going to start going through some questions that we received in the Q&A, and you all are welcome to keep adding questions there for our two speakers. So first, I'll just address this one, and I know we answered some of you in text form. If you are looking in that handouts tab, the slides will be there very soon. So even if they're not there yet, they will be very soon. I know some of you are asking for the slides, and they'll be available to you. Another follow-up question that we had actually for you, Rima, was could you repeat some of those tools and those acronyms for assessment that you mentioned earlier? I know that the CDC Health Literacy Index was one, and folks were wanting to hear those again from you.
Absolutely. I do want to point out that there's an important similarity amongst all of these tools. Some of it began, can you see this little book that I have? It's one of my books that I have both in my locked home, my home office, and my locked actual office. It was making health communication programs work. It provides a checklist for you, which is like a tool for writing and communicating clearly. The Dope, Dope, and Root book, done in 1996, is a classic. They explain how to go through all of these steps, almost all of which are reflected in Barbara's conversation and presentation, teaching patients with low literacy skills, and they provide a tool that was called the SAM, S-A-M, the Suitability Assessment of Materials. There are a lot of people in the health world who thought that it took too long to do this, and they wanted shorter forms. So the CDC index was developed, as was an instrument called the PMAT, P-E-M-A-T, which can be found online at AHRQ, the Agency for Healthcare Research and Quality. All of these instruments are very, very important in giving insight into how to develop materials, as well as insight into the assessment of materials. It's important to keep in mind a distinction between available materials and actually accessible materials. And unless, as Barbara pointed out, we engage in really rigorous formative research, we can make lots of material available, but it's not necessarily going to be accessible.
Thank you so much, Rima. Okay, our next one is for Barbara, I believe. Does the center have a source of funding to do the federal report card work, or is it done voluntarily by health literacy volunteers?
Well, Casey, as you know, this is not a funded project. This is something that is done by our volunteers. So these are individuals who are active in the plain language community, or people who come to us from many other communities. We have many who have come out of the health literacy environment and come to us and say, hey, I want to be a judge. We work with those judges. We help them understand the standards and the grading process, the criteria that we use. And then they do this rating. And it's not the same group every year. I also think this is a great time to mention that in addition to the federal report card, we also each year have something we call the Clear Mark Awards. So we give an award for several awards for clear information in different types of content, infographics, brochures, reports, things like that. And then we also give a Grand Clear Mark Award. And again, that is judged by volunteers. And so each year we have up to 45 judges who work with us, who have been trained to use our criteria, and they judge for the Clear Mark. Some of those go on to judge for the federal report card. So this is certainly something that we do really because we have such dedicated volunteers that do this work. And this is really powered by volunteer efforts.
Awesome. So someone else asked, and I'm sure you can both address this one, what resources do you recommend for conducting focus groups for user feedback?
I'll start, Rima. This was, so when we talk about testing, there are different types of qualitative tests that we can use, of course. You can use focus groups. You can use one-on-one testing, cognitive testing, usability testing. Each one has is slightly different in terms of what you're looking at. In terms of the project that we did on the MPP, we started at the beginning with focus groups. So we wanted to talk to quite a few people at one time. And focus groups are good when you want to get some general opinions from a group of people. They have negatives because sometimes when you get into a focus group, you don't really get to do a deep dive on a document. It's better for having a dialogue around a topic. Sometimes you can have, in focus groups, when you have up to 8 to 10 people, it can get difficult to hear from every voice. Sometimes you have stronger voices that will dominate a conversation. So those are some of the hazards of focus groups. But they're good, again, for general dialogue around a topic. When we actually had created the documents and gone in to test those documents, we go to one-on-one testing. So we're really dealing with one interviewer, one interviewee. And that gives you the chance to really watch them, observe them, use a document. So I just wanted to clarify that there are different types of qualitative research approaches. One of the documents that one of the books that I like to use is A Practical Guide to Usability Testing. That's Jenny Reddish. And she has done a lot of work in this area. And that is a really, for me, was a very definitive guide to conducting usability testing. She has other sources as well. And I also have found that, particularly in terms of online information, Nielsen Norman, their website has a lot of good information. And I will try to look at I'd like to continue this dialogue after this. So I will look for more resources as well. So the individual who asked that question, feel free to reach out to me, or I will try to reach out to you with more of a bibliography that could help you.
I'm going to add a note here, if I may.
Sure.
Thank you for listing those resources, and I think it's very important. What I've noted, however, is there's something missing from many of the resources, no matter which of the qualitative techniques you're going to use. And that is a focus on maintaining the dignity of the participant. After all, people are very disquieted if they reveal their inability to read well. We never want to put someone in a position or situation where they're going to be embarrassed. So you have to adapt any of the qualitative techniques. And I'll give you just a brief example in regard to a group discussion or focus groups. So I always do something that is somewhat kind, I would say. I tell people that I apologize But I'm not going to have you just read this brochure on your own. I have to read it to you because that's the way we do things. So as I read it to you, you'll notice that we've passed out many highlighters, different color highlighters. I'd like you to read along with me and use the highlighter if you think that someone you know, a member of your family or someone you work with doesn't read well. If you think that person wouldn't understand this word or phrase, please highlight that. That way, a person is not revealing his or her deficits, as we might call them, but they're speaking for somebody else. It's a kinder way of approaching it. I'm not putting someone in a situation where they have to read something on their own. I'm putting them in a situation where I'm giving aid, but it's aid in a global and kind way.
I can't agree more, Rima. I can't nod more because I completely agree with you. I think that when you are testing people, that is a very unique and can be an incredibly unnatural situation. I always start by saying, I'm going to be asking you some questions, and at times it will feel like I'm testing you, and I'm not. I am testing this document, and any information that you give me is good feedback. I also agree that you want to ask people to view it in terms of what someone else might have trouble with. So can you tell me any words or phrases that someone else might have trouble understanding? We don't want to put people in an uncomfortable situation, and we want them most of all to know that what they're doing is so valuable to us. They are giving us incredibly valuable information that we can't get in any other way. One interesting note, and then we'll move on. I've been doing usability testing this summer via Zoom because we can't do in-person testing. And I have been shocked at how much more natural it feels to people. And I think it's because they're in their own environments. That there's almost a sense that there's a, whew, I'm just here, I'm here in my own space, my dog's under my desk. They'll even say that, hey, if you hear snoring, it's my pug. And you feel almost more of a natural connection, which I was shocked by because my first thought was, oh boy, this is gonna make it even more unnatural. In fact, it's felt almost less unnatural.
That's great, Barbara. And we actually had a question about pivoting those focus groups to virtual, and I feel like you just answered it. So thank you for talking about that a little bit. We have a couple of follow-up questions about the federal report card. Barbara, if you'd like to answer them. One person asked, do you know if there are plain language standards for state agencies as well?
There are not standards that I know at the state level. However, I'm not sure that, I believe that the same types of standards can apply whether you're looking at the state or federal level. I've done quite a bit of work as well at the state level. And sometimes, as you know, there are federally funded or federal initiatives that really are administered at the state level. So we have done a lot of work with SNAP applications. So that was federal funding, but working with states. And we used a lot of the same types of standards that we use, say, on federal report card to advise and help those states come to create better SNAP applications.
Great. And another follow-up question, what happens when a government organization has bad grades on the report card?
Well, sometimes we get a call from them and they're not always very happy. Sometimes we need to explain to them, really show them how we came up with our assessment. We can share the judging reports. But at that point, I see that as a real opportunity because none of this is about harming really hardworking government employees. And so I want to say that again. I have worked with federal government my entire career, and these are some of the most hardworking people that I know. So we never want to make them feel that we're just here judging. We're here to help. We want to partner with them. We want to help them get better information. So I see that as an opportunity if they reach out to say, hey, how can we help you improve that piece of information? What types of advice can we give you that can raise and elevate that? So we really want to see ourselves as working with the government and not at cross purposes.
Awesome. So this will definitely be a question for both of you from Andrea. There are so many areas of social justice in healthcare, which is where many of us work. What do you feel are the areas of highest need for the healthcare systems?
Let me begin with a more, with a general statement. We don't take information as seriously as we ought to in health and in healthcare. So I would say I'm going to speak to a global need. Barbara pointed out the importance of formative research. We have to insist that the word is as important as a drug, in the sense that the communication has to be taken seriously. And we have to approach communication with a scientific agenda that tells us that there are proper ways to develop something, test something well before we distribute it. So I think that is a key factor that we have to address first and foremost. Right now, from my perspective, the most important issue is one of disparities, which has become so blatantly obvious in our awful experience now with COVID. So for me, that's at the top of the agenda, the issue of disparities.
Yeah, I agree with Rima's position. I recently spoke with someone about the concept of prescribing information in the same way that we prescribe drugs. We should be prescribing good information, information that people can use and understand to help manage their own health. I agree in terms of disparities, and to give a quick example, in some of our SNAP work, so we're looking at really a fundamental issue of disparity. People need to use government funds. This is supplemental nutrition. They need to use funds to get access to food. This is as basic as it gets, all right? The SNAP application, one that we looked at and reviewed, was 35 pages long. 35-page application for someone to get SNAP funds that were probably around $200 a month. This is a real issue. That was a terrible application. I couldn't follow it, and I do this for a living. So to me, that's what I think we're talking about, Rima, when we talk about disparities. How can we get people access by removing these barriers, making that information simpler? And that comes down to all kinds of preventive health elements like nutritious food, like getting people access to healthcare early in a disease process. So these are things that I think we can continue to work on.
Absolutely.
Great. So folks had a lot of questions about the user testing, as I mentioned, follow-up questions. And one person asked one that I think would be really helpful for everyone. Rosa asks, what easily accessible programs, websites, or other tools would you recommend using when we don't have the advantage of holding focus groups? For example, a Word documents reading level tool or other tools like that.
Yeah, I think we always have an opportunity to test. I'm getting messages on my screen. I'm terribly sorry.
I think you're unmuted now.
We can hear you, Rima.
Oh, good. Good. There's always an opportunity to test, even in a small way. As Barbara pointed out, you don't need a large number. So I think that saying that we're going to skip testing is not appropriate. I think we can do it. We always know someone who is not a professional like ourselves that we could reach out to. Second, there are wonderful checklists that exist, both in the tools that we can use And there are checklists on usability.gov that we can follow and use as a way of guiding our purposes. Now, when we're looking at a checklist and we're making a judgment, it's very important not to make that judgment in isolation. We won't replicate the Center for Plain Language, but we can aspire to it. We need to have a little team, even a team of a threesome, where each of us three independently are filling out that checklist for a piece of material. And then we come together and discuss it. So again, we have to use as close to a scientific approach as we can in our formative research. Barbara, I had stopped you. You were starting to answer that question as well.
Oh, no, I completely agree. And I was going to say the same thing, that I think sometimes we create artificial barriers. We think that if we can't do the Cadillac of testing, that we can't test at all. And we can. I can't tell you how many things I put in front of my 87-year-old mom to test. Hey, take a look at this. Do you understand what we're trying to do here? We have also done some very cheap testing where and it's hard to do now in the time of COVID, but where we've literally gone to a coffee shop and offered people a $5 gift card if they will take a look at something for 15 minutes. We can also, as you said, work in little groups where we ask someone who's unfamiliar with our subject matter to take a look at it and tell us what they see, what makes sense, what doesn't make sense. I'm also thinking about things like the CDC index. You can go and it's very easy to fill out online or to use the tool online, and you could have multiple people using that tool and then see, do your observations match? And what are different people saying? If one of you's come up with has an 81% and one of you has a 99%, there's an issue there. What's happening? So I think there are a lot of ways that you can get creative about looking at documents. I do want to speak for a moment on readability formulas. Like Rima, I use readability formulas, but I use them as just one diagnostic. So it is often a good thing to start with. It gives you an overarching view of where this document is hitting on a readability score. I like SMOG. I like the New Dale-Chall. Those are readability scores I typically use, but you don't stop there, because readability formulas have some very real limitations, primarily that they only look at words and sentences. So you don't get that overarching holistic view of the document. You could have a document that has very easy words, but is very difficult to understand from a design perspective. So I would just say get creative about testing and try as many times as possible just to get it into somebody else's hands to take a look at.
I'm going to add just one other note too, where we're not only paying attention to words and sentences, but we're paying attention to display. And unfortunately, we don't yet have a tool that measures the adequacy of data displays, how we're communicating data. But there are wonderful people and wonderful and smart minds working on this. You'll find some really insightful work. Brian Zygmunt Fisher, for example, in Michigan, Jessica Anker at the Wheel School of Medicine are starting to develop insights and tools to look at the adequacy of how we display data, which is very important as well. So there are things underway. There are more tools, there are more checklists underway. And I think it's really imperative that we become familiar with what's available and then become experts in that as well, to share that information, to share that knowledge, because if we make information accessible, we're really supporting social justice.
Barbara, oh, thanks, Rima. Barbara, you mentioned that the readability testing tools often focus only on words and sentences. And I think I have a great follow-up question from an anonymous question from someone here about our relationship with UX designers and UX researchers. So they write a lot of patient documents like the NPP for doctor's visits, dietitian visits, and healthcare, telehealth care on cell phones, apps, and tablets. And they want to know, are we also working with UX? So for anyone who doesn't know UX, that's user experience, UX designers, UX researchers, and UX writers on these plain language initiatives.
Absolutely. I think it's really important that you think about information, not just where it is right now, but where it's going to be in a year, 2 years, 5 years, and that you create with that end in mind. We work with a lot of UX professionals, and I think it's critically important because that's where we're going. And that's where our information is going. I don't know that we will ever be paperless completely, but I think that's where we are all maybe hoping we're going. And let me give you a good example when you look at the NPP, thinking of that from a UX perspective. One of the criticisms when we first started developing it was that it was long. So by using some of the design elements that we used, it suddenly was a much longer document. Well, it was a much better document in terms of document design, but it was many more pages. However, that information was much more, it would be much easier to migrate to an online environment because it was already chunked and ordered in a way that you could use on a patient portal like a tablet or like a computer screen when someone first comes into an office and they want you to read through it and then be able to signal that you have read it and understood it. So in a way, part of that job of migrating that into an online environment was done through the structuring and ordering and organization of the information. But again, you would still need to test and test and test. Because no matter what we think it looks like on paper or that we think it's going to migrate well to an online environment, you would want to watch people use it in that environment, watch them use it on that touch screen, and then see how well it works there. So absolutely, we need to be working with UX professionals in terms of kind of moving this stuff into the next century.
Great. So here's a really interesting question. Have you encountered any discrepancies between what health literacy best practices suggest and what patients want when you co-design materials with them?
That's a really
I have not, question. In my experience. I have not.
It's a great question. I agree with Rima. I don't know that I see some massive discrepancy in what users want and what typical health literacy or other plain language best practices suggest. What I tend to see is sometimes in using principles of good design, sometimes you see things that work better or worse in that particular situation. So it's not that the principle is wrong or using that principle in that way is wrong. It just might be that there's a better way to implement it. And a good example I was working on, this was actually a legal document, but they had used a lot of design elements, a lot. And what we were seeing was that users almost felt maybe that it was overused. The design elements were overused, which is an interesting finding. You don't see often, but it was almost as though the design was confusing them in some ways that we hadn't anticipated. So that's an example of why looking at it with users makes sense. There's no big discrepancy between the principle and what people want. It's just that it's almost a matter of degrees.
And here's a question about sort of localization. So there can be differences in opinion as to what people believe to be the most commonly used and understood words and terms. So for example, is there a good resource that includes a research-based assessment of commonly used vocab in the US? Or I assume they're thinking of, different regions or other places as well.
There was a time, and I don't know if it's still being published, but the CDC had a glossary of terms. And I know that it was published for quite some time. I had not seen it online recently, but I know that a number of groups and agencies are preparing and have prepared glossary of terms, because after all, there are words that would never come up in a readability assessment, like risk, range, normal. They're not complex words. And definitions are hard to come by for these very important words. And I think that we need to pay attention to that and perhaps redo from time to time, and especially in emergency situations, we would probably do well to have a glossary of terms related to COVID right now. It could serve the public quite well.
Yeah, I agree with you that there was a CDC glossary. I'm not sure if it still exists. I know that the CDC has a glossary of Spanish terms because we just worked on a health document and we're looking at the most commonly used Spanish terminology for certain words like ACA or copayment. But I agree that it would serve us well to come together to create something like that. And I also wanted to note that one of the reasons why I like the New Dale-Chall readability formula is because in addition to giving a grade level for the document, it also shows words that don't show up in a commonly used word index. So it will pop out words that it doesn't feel are commonly used or familiar. And so that's an interesting side to that. That's why I think that's a useful readability formula, because I like to see what those words are. So just wanted to add that piece of information.
Okay, here's a very sort of practical question. What certifications or other trainings are available for plain language use?
That's an interesting question, because this is a really new area of study. I started working in this area in '95 at the Document Design Center, which was really, we were doing applied research in document design, how documents were designed and what people could use. And they're really, what people who came into this field were coming out of all types of different areas. There were some usability specialists, there were some coming out of rhetoric, and some coming out of English degrees. Now there actually are some plain language certificates. Simon, I'm probably pronouncing this wrong, Simon Fraser University out of Canada has a plain language certification that you can get. And I think that's a really good place to look if you are interested in this area and getting some of that. There are also more and more universities are building in plain language certificates or areas of study. So I think this right now is building, but I certainly would look at certifications that exist online through universities as a first stop if you're interested.
And someone asked, Barbara, could you please repeat the 3 organizations and the 3 websites that focus on plain language?
Yeah, so there is the Center for Plain Language, and that's centerforplainlanguage.org. There is Clarity International. I'm not sure of that website, but if you look at Clarity International, and the final is Plain, that's capital PLAIN International. So those are 3 organizations. Plain and Clarity are fully international. The Center for Plain Language is a North American organization.
And we also have some questions. people are curious about funding, so I'm going to read these two questions together because they're very similar. So the first one is, did the federal agency fund the user testing that took place and the material that was developed? And can you talk more about getting funding for this type of project? And then someone else asked, how can we articulate the value of plain language to funders who want to focus on disparities and sort of prove to them that this is a proven solution?
Yeah, so that was a funded project, and that was done through through my organization, which was Kleiman Communication Group and is now Kingsley Kleiman Group. And so that was something that that organization had decided to fund, and it was a pretty large project. There are many projects out there in plain language, from small to big. Sometimes those are advertised. You can get do proposals for projects, looking at government websites that will tell you, hey, this is a project that's coming out on plain language. In terms of funding through grants, I'm going to let Rima answer that, because in terms of just plain language, it is not so common just to get a grant. But I believe that the value that you would want to show is twofold. So one is plain language has been shown to save money. Okay, and people love to see this, that if you write things in plain language, people can take action better, faster. They need less touches from the organization, and that saves the organization money. So that's always a way to make your case. Another is that is really that it helps users be able to do what they need to do with less help and less intervention and more ability to do it independently. So organizations also find that compelling. So you want to make the case of how this helps users, but also how it helps organizations, because it helps both. You build efficiencies for both the user and for the organization when you use plain language. And Rima, I'm going to throw that over to you about grant funding.
Grant funding is difficult, and difficult certainly more so in these times than it was even 10 years ago. There are several layers of arguments that we need to make over and over again. One, we can use the data that exists from the 1992 National Assessment of Adult Literacy, the 2005-2006 Adult Literacy Survey, the 2011 PIAC, which was PIAC, which is an international assessment in all OECD nations, with clear evidence that the majority of people in the US and in many other industrialized nations cannot successfully use readily available information. Period. They cannot successfully use available information. So there's a serious problem. So that data in itself makes an argument for paying attention to plain language. But then we build that argument by talking about enhancing trust, by looking at respectful dialogue, by following scientific principles of rigorous formative research. Those arguments can be made quite succinctly, and you can find many of them available online. There are more and more studies, a call for proposals and studies that do indeed focus on health literacy as an aspect of it, as an aspect to help other aspects of the proposal. So it's rare that we can find money to do just translations into plain language, but we can find monies to do translations as part of an asthma project, as part of another project. So more and more, it's a need for collaboration and partnerships, where health literacy is a key and important component, but it's not necessarily the focal point of the funded proposal.
Mm-hmm.
I know that's a general answer. I hope it's helpful.
Here's a follow-up question for Rima. So someone wants to know sort of the end of the story after you connected with the Center for Plain Language, and they ask, what was the outcome of Rima's work with the Southern Poverty Law Center?
Well, there are several outcomes. Barbara, I think that you're in a better position to speak to it because you continued on, I think, with work with the ACLU. So forgive me for punting that, but I think that you can speak to that directly.
Yeah, so the amicus brief was filed, and that was, I believe that case is ongoing, and that was North Carolina. And North Carolina had, as Rima mentioned, a very difficult DMV notice that we were looking at. ACLU has continued on and now has filed a case in the state of South Carolina, also looking at their DMV notice, some related statutes, as well as things like the traffic citation that people get when they are stopped. So that is ongoing. And this is just, it's a perfect example of how information that we take for granted in everyday life, things like a traffic ticket, can be incredibly difficult to understand and provide a huge barrier to people being able to exercise their rights and understand their responsibilities. So yes, that work is ongoing. And I think it's really exciting that these organizations are continuing to take on some of this everyday information and really say, hey, this is a barrier. This is a barrier to people's understanding and it's causing real harm. How can we fix this? So ACLU, Southern Poverty Law Center, others are really doing the work out there to raise awareness as well as really go in and bring these cases.
Right. We don't know the outcome yet of
Nope.
those.
These are both ongoing.
Right,
Yeah.
they're ongoing. However, in my conversations, which are ongoing with the Southern Poverty Law Center and the ACLU, I'm trying to highlight the fact that literacy, health literacy, plain language can be a component of so much of the work they do. They hadn't really been attentive to that before. So this is relatively new to them. Notices about water quality, notices about job exposures. There are so many small complexities that are embedded in other cases that relate to social justice and inequities that they can now start having that component that pays attention to language inserted into their work. So I find that possibility very exciting.
Thank you both. So we got a couple of questions and comments about the use of graphics or images. So one person mentioned that they think folks with lower literacy like to see a lot of images and less text. And then someone else asked, are there specific graphics or images that work better for folks with lower literacy? So a number of questions about, you know, the role of images and graphics.
I would start by saying we all like to see pictures and graphics. So that isn't just people of low literacy, and they can be helpful to us all because they engage different parts of our brain. So that ability to see a visual in some ways can help us take something from our immediate memory into our deeper retrieval memory faster, because we have a graphic that is connected to it in our mind. That being said, I see a lot of terrible graphics being used. And that is the biggest issue that I see, is that graphics are often used as almost adornment as opposed to helping with meaning. So a graphic shouldn't just be used because it looks good. It should be serving a purpose for that document. And it needs to be connected to the information in a very clear way. So, for example, sometimes I see a graphic that maybe even works in opposition to the information. So I think as designers, the first thing we need to do is really sit down and say, is this visual helping with the understanding of the information? Is it connected? Is it relevant? Is it useful? And then also looking at cultural elements. Does it meet the needs of all of the audience? Is it in any way culturally biased such that we have user groups that wouldn't understand what it means? And then again, and I hate to sound like a broken record, this is a perfect place to go back and test. Really see if that visual works. Do they understand it? Is it helping them? Is it helping them move that information into retrieval mode for the future? So these are things that we need to think about as designers, but then also test with our user groups.
That was superb, and I completely agree. The danger is that people like to throw in a graphic because they want to use some space, they want it to look pretty, and it distracts from the important information. You never want it to distract. And of course, the formative research, you test the graphic as well.
Okay, we got a couple of questions about how all of this overlaps or intersects with spoken language or spoken materials, which I know a question that I see a lot about plain language. You know, what does it cover and what does it not cover? So is there any guidance regarding spoken language for health literacy that you two could share?
I would claim that all of the principles involved in plain language apply to the spoken language and dialogue and presentation as well. Period. That there's not a disjuncture.
Mm-hmm. I would agree. I think that particularly when we are dealing with people in vulnerable situations, we need to be really clear with our information and instructions. And I think that that is something that is just as important, if not more, in spoken language than in documents. Often when people are in situations, particularly an emergency situation or a difficult situation, they become immediately overwhelmed with the amount of content coming at them. So I think we always have to be careful that we are structuring and organizing the information that we're giving that person in a spoken way. And then I would say even more that we're always checking for understanding. So that's the one thing we can do in person that we can't do as easily in a document, is we can ask them, what are you thinking right now? Can you tell me if you have questions? How would you say that in your own words? So there are ways that we can check for understanding with someone. And I think that's something we don't do enough. Really, just period in life. We don't do enough is check for understanding. So I would add that it's those check-ins that are important.
And that being said, I would say that there are other things that we have to pay attention to in our presentations and in our dialogue with people. We have to pay attention to our voice. So we need to look at the pace of our speech. We need to look at the tone of our speech. We have to look at our affect as we're speaking to people. And we have to pay attention to our accent. We all have an accent. So my accent is from the Northeast. Do I do as well when I'm working in the South? Do I feel and sound as warm as I do when I'm speaking to my cultural group? We have to pay attention to additional aspects when we're making translations into the spoken word as well.
All right, and we are at the time for our final audience question. So I think I found a really good one to wrap things up here. But before I read that out to both of our panelists, I want to let everyone know that if you had a question that we didn't have time to address, there's a discussion tab on this session page, and you can enter questions there. And Rima and Barbara have agreed to continue engaging with your questions there and answering them in the coming days. So if we didn't have time to get to you, or if you have a follow-up question, again, it's the discussion tab under this session's event page. So you can use that as well. So for our last question, kind of moving from the start of the process to the end, someone asked, is there a tool or a way to measure the impact of plain language in patient care in achieving more positive patient outcomes? So how do we know if it worked, and how can we kind of show that it helped?
I can't summarize her work here, but I would say that there are a number of researchers who are looking at a variety of elements and components of the dialogue in patient care. And plain language is very often a part of it. And so you might look at the work of Deborah Roter, R-O-T-E-R. She's at Johns Hopkins, a professor at Johns Hopkins, and all of her life's work is really focused on the interaction in the clinical setting. And she looks at a variety of components of that interaction. So I think her work would stand to be very insightful to answer that question.
And I think I would say that when you're looking at outcomes and you want to measure that, the most important thing, and you're going to try to look at how information changed those outcomes, I think first you need to start by figuring out what you want to measure. So what is the health outcome that you're trying to change? What is the element that where are you trying to move the needle? When you know that, then you can more specifically address the information pieces, and you can then later go back and see change potentially based on that use of information. But it really all comes down to how clear you are in what you're trying to do. What is the change you're trying to make? What is the action that you want that patient to take or you want that clinician to take? So I think when structuring any kind of an evaluation like that, it's so important that you're clear from the beginning in what it is that you're trying to do.
And I'll just give one example that from Deborah Roter's work. One of her early studies looked at tone and exchange, how frequently a patient spoke and how frequently the doctor spoke in the interaction, and a few other elements of the interaction. And one of her outcome measures was missed visits. And she saw a tremendous improvement over time in the number of missed visits based on characteristics of that dialogue and discussion. So outcomes can vary, as you point out.
Okay, well, thank you for all of those generous questions and answers, Barbara and Rima. Is there anything either of you would like to say to the attendees before we start signing off?
Yes, we have skills, we have insights, we have tools that we can use not only to improve the nature of our work in health, but that we can partner with others and use effectively to really improve and eliminate disparities. We have actions that we can take that can really serve our democracy well, as Janet pointed out yesterday, to improve our court system, as Barbara's work has illustrated. We can take action based on what we know and what we're able to do. I'm hopeful.
I can't say anything better than Rima has. It's a pleasure to be here. And I think it's really important that we recognize, as you said, the skills that we have and this really unique value that we can bring to the world as advocates. And that's what we're trying to do every day. And it's exciting to be here in a slightly different world, but just to see how much we can be doing together on issues around social justice. So I am happy to connect with everybody, and thank you so much for your time.
Great.
All right. Well, Barbara, Rima, thank you so much for your time and your expertise today. And thank you to all the attendees and participants for being here. Again, if you have more questions, you can use the discussion tab. And I want to remind you all again to visit the Engagement Center on the conference homepage. If you have thoughts that you wanted to share, follow-ups, you can share your ideas in the plenary sessions work group in that engagement tab, and we'd love to hear from you there. So please don't forget to complete your session evaluations and your overall conference evaluation tomorrow when it's sent to you, along with your request for any CEUs that you'd like. And the recording of this session and others will be available after Friday. So thank you so much for joining us. Thank you again to Barbara and Rima. Have a great day, everyone.